Hello, everyone, and good afternoon. I'll be presenting a debate about should genetic information be integrated into healthcare databases for better public health planning and what are the privacy concerns. I'll be in the negative team. My name is Sarah Ahmed. Well, let's start with a little bit about genomic technology. Well, there is fast-paced development in this field and in genomic editing as well, which raises serious issues and concerns for the medical sector and the policy makers and also for the public. Genomic illiteracy, autonomy, confidentiality, privacy, and equity are major concerns that really challenge the advancements of genomic medicine right now. The complexity nature of this genomic data and the presence of still uninterpretable information really cumbersome the integration of these data into the healthcare system. Throughout this debate, we will be addressing these serious concerns that accompany the integration of those data into our systems. We are concerned about integration of genomic data into the healthcare system because of violation of human rights to autonomy, confidentiality, non-discrimination, and proper healthcare are serious issues that needs addressing. In our argument, we will tackle those concerns and urge policymakers to secure individuals' rights whilst advancing medical care. Our first concern is the access to testing for the beginning. Well, most of African countries, if not all, have limited access to genetic testing, mainly due to cost and lack of insurance coverages. Electronic health records, for example, are sometimes deficient in African countries. Some countries don't have electronic health records at all, which makes integration even harder challenge. Early access to testing without well-designed decision support for physicians and the availability of subsequent interventions might lead to public mistrust, misuse, abuse, or even non-compliance and non-testing at all. These concerns, there should be a mechanism for advanced review of genetic testing when other genetic services are there to assess if they have really scientific merit at all or they are efficient. So we have to have available electronic health record, decision support for the physician, and subsequent intervention and support for the patient before we even make the availability and the accessibility of the test there. Our second concern is the acceptability and religious beliefs and cultural beliefs within our African countries. Well, up till now, some African countries still report negative attitudes from their population towards genetic testing and information. For example, in Egypt, a study in 2024 reported that that negative attitude might be attributed, still there, and might be attributed to treatment concerns, financial constraints, and still personal beliefs as well. In Nigeria, in 2023 study, they show less willingness of Nigerians to having genetic testing, and they link that to finding to lack of genetic literacy. So such concerns can greatly hinder introduction and integration of genomic data and testing, and addressing those reasons behind this negative attitude is mandatory. Also, an important aspect of conducting the genetic testing is not just the acceptability, but if the public is not the flexibility of doing the test, is acceptability of what's after that. So the decision relying on those tests, the acceptability of these decisions. Otherwise, why are we going to do the test? There will be it's questionable to do the test and benefit of testing as well. So a study was done by Gohori in 2008. They offered 30 Egyptian females, for example, having high-risk pregnancy for beta thalassemia. They offered them DNA sequencing for the fetal tissue prenatally. Out of 22 cases with affected fetuses, 14 couples refused to terminate pregnancy, which reflects cultural and religious beliefs. Also, fear of being socially stigmatized for using genetic services or having genetic condition as well is particularly is common in rural areas in Egypt, highlighting also the cultural consideration for Egyptians that should be taken into mind while doing acts policy supporting this genomic testing. Our next and major concern is the privacy concern and disclosure of sensitive information. Privacy of data is one of the human rights, and concerns about breaching those data are justifiable. Like, for example, in 2018, 23andMe sold the data to participants to GlaxoSmithKline company for $300 million. And in 2024, just this year, hackers were able to access 7 million people's data from 23andMe. So imagine how people would be actually skeptical about doing testing and for it to start, and not just integrating this data into the healthcare systems. So effective implementation of genomic medicine will require healthcare records, electronic healthcare record system that exchange information between like companies, between hospitals, between several entities. These data sharing needs governing, needs securing, which is also challenging as well, putting more burden, more effort, more cost on how to secure those data. Patient access itself need to be secured and prevent breaches. For example, like in case of device losses, in case of login issues, it should be secured. Sharing data with insurer companies is something else. It's like we do share data for reimbursements. This data shared could lead to discrimination and eventually will increase cost of insurance or even refusal of insurance for the individual or even the offsprings, the relatives, if they carry risk. Currently, several African countries still lack this acts for discrimination based on genetic information and privacy protection of data. Some of our countries have these acts in place, while others still developing. Also, a survey, for example, the survey for insurers was undertaken by the Office of Technology Assessment in USA back in the 90s. And the insurers generally believed that it was fair for them to use genetic tests to identify those at increased risk of the disease. 3/4 of the responding companies said they thought an insurer should have the option of determining how to use genetic information in determining the risk. Afterwards, of course, there was the GENA Act to prevent this discrimination that might accompany such information. Also surveyed by Paul Pillings and colleagues, as well as the Office of Technology Assessment, uncovered specific examples of people who were actually denied health insurance coverage based on their genotypes. Coming to our next concern, which is the consent, is very complex, and the data revealing. Well, genetic testing consent is one of the most complicated consents. It requires thorough understanding of both the physician or counselor and the patient to start with. So there are many questions to need to be answered, like what to reveal to the patient, what to reveal to the physician, what to reveal to their relatives. Thus, a highly sophisticated medical record should deal with such a huge amount of data and aspects of consents. Also, some of the variants, for example, are uninterpretable for years until research is completed and strong answers were found. How those data would be revealed and how to deal with them being conveyed to the patient. And some tests also need specialized team to convey these results, which might be challenging if, as well, we are just, if these data were just available on the electronic medical records. Also, a big dilemma for the physician as well is the duty to warn. When facing genetic risk for patients and how you're going to warn their families, it might be even more complicated when these data are just available everywhere in the electronic medical system. The right also not to document genetic data. People should have the right, especially if they have stigmatizing genetic disease or even life-threatening one. It's also an ethical dilemma. Patient selectivity of genetic data availability. Some patients would select these data to be available on their medical record, while other data they would not rather it there be available. So we have to segment data what will be available or not. So how we're going to do that in an electronic medical record, and would these restrictions would be made for some part of the data would be lifted in an emergency situation or not? That's another ethical dilemma. Our next is the illiteracy, genomic illiteracy that's present. Well, people fear what they don't understand. That's a major challenge for incorporation of genomic data at the near future. It's equally important to eliminate as well physicians' illiteracy about genomic medicine and increase number of genetic counselors, which would impede the use of genomic testing in clinical practice if it's not addressed. Even if a provider also can build competence in working with genomic testing, they still would face difficulty finding time to address all the relevant findings from all the genome. Well, it's been estimated that this the physician would take like 5 hours to adequately inform the typical patient of his or her genomic risk profile. Of course, having an electronic medical record, robust electronic medical record and algorithm would make it easier, but that's also a challenge. Our final concern would be like advancing the genomic medicine research into the public health. Well, still the genomic research in Africa is still in its infancy, with lack of complete data in most countries for the reference genome for their population. Consequently, many generated data from genomic analysis right now could be misinterpreted when aligned to other databases that already are not that diverse. Well, there are several initiatives to have diverse reference population databases, genomic databases like all of us in USA, but still they are at the beginning, and we do lack that reference genome for our population, that solid reference genome for patients to start with research. Well, I'll be closing my argument with this statement. While integrating genomic information can be of great value, and in some cases, it's actually life-saving, several concerns are still present and need addressing. Preserving patients' rights for autonomy, confidentiality, privacy, and literacy are mandatory for the advancement of genomic medicine in healthcare. Educating, training, and maintaining knowledge of physicians and the public is a cornerstone for the success of genomic-based healthcare delivery. Finally, balancing between improvement of healthcare and the need to reduce harm is of utmost importance. Thank you very much.